A new opioid awareness campaign is underway in Tennessee, featuring the stories of the real people whose lives have been devastated by the drug epidemic. Yesterday, the Centers for Disease Control released new data that showed overdose deaths actually declined for the first time in nearly 30 years. But many are still in the grips of addiction. Tennessee is among the hardest hit states when it comes to the opioid addiction epidemic. The Tennessee Department of Health said last year alone there were more than 6 million painkiller prescriptions issued in the state. 1,268 people died of drug overdoses. That was in 2017 alone. But behind all those numbers are actual people. Feben Cassahoon shares the powerful message of two people in this region impacted by the opioid crisis who are now part of the solution.
Josh, as the U.S. faces the opioid crisis, Sherry Barnett and Angeli Marie are sharing their stories in the hopes of curbing opioid addiction in Tennessee. The Tennessee Department of Health says every 2.8 minutes, someone in the world dies from an overdose.
I really shouldn't be here. At the end of my addiction, I had like a 50 to 60 Roxy 30 snorting habit a day and trying to function.
5 years after battling addiction to opioids, Sherry Barnett is now fueled by helping others to recover.
Today I work as a regional overdose prevention specialist for the state of Tennessee. Recovery is my passion. I don't want people to go through what I went through.
Barnett is sharing her personal perspective on addiction in the Department of Health's Faces of Opioid Crisis awareness campaign.
I live my recovery very loudly, and the reason I do that is because I don't want people to die silently. I want people to know that there's help out there, that people care.
People like Barnett want addicts to know the road to recovery isn't something you can put on cruise control, but with help, you'll be able to get back on track.
You know, of course, you have stress that adds to those things, and poor eating habits and poor health habits all the way around. And all of that adds to life in general.
Angeli Marie stopped taking opioids 11 years ago, but she says it was not easy.
I had to have it to survive. I had to have it for oxygen. It was almost like oxygen or air.
Marie wanted to help others facing the same battle, so she founded Red Legacy Recovery, a nonprofit for women in recovery.
Our goal is to help them become self-sufficient and help them become employed and help them begin to live positive everyday lives.
Opioid addiction does not discriminate. According to the Tennessee Department of Health, more than 900 babies in 2018 were born with neonatal abstinence syndrome. Reporting in Johnson City, Feben Cassahoon, News Channel 11.
Feben, thank you. The Tennessee Department of Health invites people to share how they have been impacted by the opioid crisis. So many have a story. You can find the link so you can share yours on WJHL.com.